Good morning, Bernie.
Good morning.
Hi, Jessica. How you doing? Don't have this thing mute, do I? Huh? Should be working.
All right, good morning.
Good morning.
Now you can hear us.
How are you today?
Good. How was your holiday?
Good, very good.
Good to hear.
We had Thanksgiving virally with FaceTime with the kids.
Oh,
That's Bernie, isn't it? Bernie?
yeah, I'm here.
I got some detailed questions for you, see what you know.
I know.
On land right away.
Morning, Ken.
Morning.
How'd you do deer hunting?
I shot one bull hunting, 17, a little better than 17 wide. Gun hunting, I didn't see no nice bucks, so I didn't shoot nothing.
You get something, Dick?
No, I didn't go hunting.
Oh. Anybody on your land go
We got one. My grandson got one.
Nice.
1 buck. That was it. Got the muzzleloader season though.
out? Yeah. Put it down.
Morning. Yes, we gave you your chair. We gave you the best one.
Morning, Dennis.
That's morning. Okay, the story behind that. This cap is 1994.
What were you doing in New York?
World War II.
Oh.
And archive, but I still got it. I got shirts from 1990, that land in Georgia, World Washington.
They're not rotten yet?
No, no, they're a little tight.
Oh,
I just do it just for the grass, but we still got that shirt.
so the township is selling some right away? They have a meeting coming up next week, Tuesday?
Well, no, this happened way back in 1985.
Okay.
The town was gonna extend Ernst Road all the way to the next 40.
Okay.
And that was decided in 1958. And in 85, they didn't notify any landowners. They resolved it, decided not to extend that road. But it deleted my right of way because they took everything out. And Pagel bought the land, gave us a right of way. But we didn't know that they're deleting the other one, which I don't think they can do.
If there's an easement right away, no, they can't take that off of a contract. If there was an initially an attempt to purchase the land for the township or something like that, but it never went through, then that shouldn't have ever been changed over, that they could
No,
take that right away, or that easement or whatever it was.
easement right of way,
Yeah.
that's what it's called,
Yeah.
easement right of way.
Yeah, as long as that was in the contract from whatever it was, 85 yet, that they never,
But
didn't purchase the land.
the argument you're saying is that that was between the town and the landowner. But it was to resolve the fact that it was 240s back there that were gonna be, that was landlocked. It just didn't make any, it don't make any sense. And we got an agreement, but it ain't got the stamp on it. And Bob Bagel signed this back in 85. This was supposed to have been a side land with the existing agreement. But he went behind our backs. I mean, it sounds like a crude way to say it, because we were never notified what was going on. And I found out about it last year. So we've been arguing this thing for over a year and a half now. And now it's coming to a head.
That sounds like, try to get the township attorney involved to find out all the legalities of it, but I would think that that would be,
That's kind of what I was thinking. I gotta call Sharon Olson up at County Union. And then see. She did already look back at very poor paperwork prior to 1985. But there has to be, none of us were never notified.
there must be something in there about using something.
Well, it's on Pagel's, on that 40, it's written, it's stamped right on there, on the top, that there is an easement right away. But the proper
Are we
document,
ready to go?
Bob?
Yes. I'm sorry, I've been sitting here not pushing the right buttons, but that's kind of what I do anyway. Okay, I think we're all here. This meeting and all other meetings of this committee are open to the public. Proper notice has been posted and given to the media in accordance with Wisconsin statutes so that the citizenry may be aware of the time, place, and agenda of this meeting. Only in-person public comment is allowed. Woo! Moving on, calling this meeting to order. Roll call looks like we are all here. And moving on down to review and amend or accept the agenda.
I so move.
There's a motion. Is there a second?
I'll second it.
There's a motion and a second to accept the agenda. All those in favor say aye. Aye.
Aye.
Moving on. we're down to review the previous meeting minutes, which I did, and I would move to approve them.
I'll second that.
There's a motion and a second to approve the minutes of the previous meeting. All those in favor say aye. Aye.
Aye.
Moving on down to correspondence. Chris?
I do not have a record of any.
Good deal. Moving on to outreach education or program reminders.
All right, so not only is it a Monday, but it's a Monday after a holiday weekend. So Jessica is going to be our featured presenter this morning, so we'll allow her some time here. Christy is just coming online. One of the things with our staff that we've had, especially with Penny and the 4-H staff, there have been some, obviously with the surge in COVID, there's been some, not saying 4-H programming has ceased, but there's increased scrutiny in the review to make sure that everyone is safe, just to make sure things like that. So I know Penny is very busy trying to work on how can they do service projects or community activities such as bell ringing and those types of things within a safe environment, not only for participant, where for the members, but then anybody else. So those types of things are happening. So just a couple of updates along with everything else that's written in the written reports is the overview. So if there's anything else that pops up, we'll share it, but otherwise we can move on in the agenda.
Okay, well, let's do that. We're down to educator reports. Jessica.
Good morning.
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 I invited a couple guests here, and full disclosure, I told them that I thought it would be a few minutes after 8:30, so they might be trickling in a little late. But I do have Adam Belcarelli here. He is with East Central Wisconsin Regional Planning Commission. Adam, would you mind just sharing a little bit about what you do? Because you're also new with East Central, and Waupaca County is in East Central's area. So I think it might be nice for these guys to know a little bit about you as well.
Absolutely. Good morning, everyone. I'm Adam Belcarelli. I am a transportation planner with East Central Wisconsin Regional Planning, as Jessica said. So East Central Wisconsin Regional Planning Commission is a quasi-governmental agency where we help basically counties and municipalities with a lot of their different planning efforts, whether it's public transit or waterway management or economic development. And so we help in between in a lot of those border areas. And so if it's something that goes across a jurisdictional boundary, we step in and help coordinate a lot of that work. And so oftentimes that'll put us in transportation specifically. And so we have a few transportation planners, although we are hiring one more if you know anyone who loves maps and wants to come and help the community. So I just started there this past summer, so in July. And my background comes from doing bicycle and pedestrian planning with the city of Oshkosh, as well as doing things with the Winnebago County Health Department, with the Rethink Coalition, and some of the community development efforts that way. So those are some of the things that we work on at East Central. So I was really excited to find a position doing those kinds of things that I had been volunteering for. Yeah, so a lot of what we do is helping coordinate how do we help the counties deliver the services they need to deliver. And one of the big ones that we've been working on with Jessica is transportation for rural communities, particularly when it comes to getting folks who don't have a car either around their community or between communities, whether it's a doctor's appointment or a social visit, although we're having fewer and fewer of those. Hopefully this is going to be part of the recovery as we look forward to the new year and figure out how do we make transportation and solve the transportation issue for people as they find that new job and as they have to start traveling outside more. And so that's some of what we've been working on.
Yeah, thank you so much, Adam. And I have to say, East Central is also the place that my career got its start. That was my first job. I worked in GIS making maps, Adam. So I've been there and done that, but I do know someone I could refer to you. All right, and the other two people that we'll have joining us, hopefully have joining us, is Tracy Ratzberg. She is with Theta Care. She's the community health coordinator that covers our region. She does a lot of work with the community health action teams that you may have heard about from us or through other means. So Theta Care has taken an interest in this project, and also Holly Keenan with Make the Ride Happen should be joining us as well, hopefully soon. So I'll explain a little more about where Make the Ride Happen comes in, because that is a nonprofit that's not their headquarters is not located in our county. So part of what I do with Extension is working with nonprofits to basically help them be the best they can be, so that they can make positive change in our communities. And so Holly, though, with Make the Ride Happen, is not in our county. However, her service area covers our county as well. And so they have an interest in building the capacity of their organization to serve Waupaca County. And so I'll start kind of with the story here. I'm going to share my screen and you'll learn a little more about this one particular program I've been working on. And then I have a summary of other programs from 2020 that I've been working on to just kind of give you a quick rundown of that. Share screen. You know, after a long weekend, I didn't forget how to use Zoom, but definitely had to search around a little bit to find what I was looking for. Okay, so the biggest thing to remember, I think, from this entire presentation, if you remember nothing else, is that this program is seeking to fill transportation gaps. We're not looking to duplicate any efforts that are already being done. Like our county does a lot. Our DHHS office does a lot with transportation with regard in particular to certain populations. We're looking to serve the people who don't fit the demographics of the people that the county and others are already serving. So we're trying to fill the gaps for instance, for workforce, trying to get people to work. And actually not just to work, but also access to jobs. We're trying to fill the gaps for people who are maybe younger, who are under 65, who don't fall into the other programs. Maybe people who are who don't have mobility challenges, because there are also programs for folks that have mobility challenges. And I'm not the transportation expert, so Adam, really at any time, or as our guests join, because I can't see everyone now, so as our guests join, at any time, you guys are welcome to interrupt me and fill in some gaps that I might be missing, because my role has been in the organizational development and in trying to help this whole effort get organized and get going. Okay, so where this began was in December of 2018, the New London Community Health Action Team, CHAT, had a plunge. A plunge is a day-long event where they deep dive onto a particular topic. This topic was transportation. The day highlighted age 18 to 59 and non-disabled. And they also discovered that there were some limited resources for those age 60 plus. So there are some people who are over 60 who don't fall into the existing programs that the county already offers, or that others in the county already offer. And one of the things I'd like to point out that they did this day was I was actually not able to attend this. This event, unfortunately. I already had another commitment, and I started talking to them a little bit later in the process. So they had already had this planned, and I had already had something else planned. So but one of the things that they did this day is they actually took the people who attended the plunge and dropped them off at different points in New London and asked them to get back to the meeting place. And from what I hear, that was a really big eye opener for the people attending this meeting, because they realized that there weren't a lot of options. There were very little safe ways of getting back to where the meeting place was. And so it was one of the things that they thought needed to be addressed, especially after taking this deep dive on this activity. And I'm just going to see if I can. Okay, so we haven't had anyone else join us. And Adam, is there anything you know about this particular day, since I wasn't able to attend? I know you weren't there as well, but is there anything I'm missing that you know?
So not necessarily missing, but just to expand a little bit. So one of the things when a program like this is set up, we know there are certain things we know we're going to find. And so oftentimes part of the challenge is helping people who tend to be in the know recognize the gaps. Because often we say, if somebody comes to us from the community and says, I have a relative, or, I have a child who needs to, graduated high school and now needs to get to work, but they don't have their own car. What do? And we always have a go-to solution. In our minds, we have, there's, this person works at the same place, they can ride together. Or, we tend to try and short circuit the problem and say, here's that solution that somebody's already thought of. We don't need to work on this. And what we end up finding in the deep dive is that these gaps do exist. And there are a lot of people who either don't qualify for the service that is available, whether it's the ADRC, senior rides, or it's a particular program offered through a hospital. Those are different things that other counties find. But there are so many folks that either are going to somewhere that's not covered yet, or they just themselves don't qualify. Either they haven't gotten in touch with the right program, or there's not anything available that covers them. And so the more that we can show those gaps, it really helps people see the need.
Yeah, thank you, Adam. Great point. So what came after, so that was in December of 2018. In the spring of 2019, the chat team developed a survey, and my role in this particular survey was reviewing and editing the survey so that they could get it ready to go out. So I reviewed it for a lot of different things. So was it easy to read? Was it asking questions that are getting at our actual purpose? And so we ended up having 163 respondents. It was primarily from the New London area, but there were a lot of residents from across the county and a little bit beyond, because New London is one of our border communities. We were getting people from Outagamie County as well, and Shawano County, and that's fine. There weren't very many. Excuse me. So what was interesting about this is that, so there were 163 respondents from across the county, but 47% of them use other methods of transportation at least 10% of the time because they need to. And 23% of the 163 don't use or have access to their own vehicle at all, which in a rural county, you can imagine, is difficult. And frankly, even within the city of New London, they did that experiment where they drove everyone out to different parts of New London and had them get back to the meeting space. It's even difficult within the city of New London. So the top reasons that they sought help with transportation were things like errands, medical appointments, groceries, and as you can imagine, all the things that you use to get around, right? We probably all have vehicles, and all the same reasons that you need to get around town or around the county or around the region are the same reasons that people who don't have vehicles need to get around. But these are all the reasons that they seek help with transportation. And I think, the difference there is if you're asking for a favor or if you're trying to find a program, your reasons for that. So medical appointments, I don't suspect that all of these people have more medical appointments than the average person. Maybe some of them do, but I think that the reason why that's so high is because when you're asking for help from somebody, you're going to do it for a reason that is a basic need, like medical assistance, groceries, things like that. So important errands.
And I'll add on to that 23%. So one of the things that we do at East Central quite often is look at the census tract data to see what are certain demographic trends throughout our region. And so there's the two that we often look at. So there's the things like median income and household house prices and that sort of thing. That tells us one bit of that information. But then this access to no vehicle or access to one vehicle is a really interesting sort of next level of this, what we're looking at, what we're trying to get at here. And so the 23% is people that have access to 0 personal vehicles. Then the other piece of that, then if you expand this number even wider, it becomes access to one vehicle. And often that's important because that is often the transportation method for the what would you consider the head of a household, but that leaves the rest of the family without access to a vehicle. And so oftentimes that number is 15-20% higher than the access to no vehicle number. So that's actually sort of that 25% of our 23%. That's a quarter of the people in the community. But it's actually more than that, because even once that one vehicle is away at work or, out doing anything else that it's doing, or if it's in disrepair and they're not able to get it fixed quickly, that number goes up quickly. So that's the two other things to just keep in mind when you look at that number, is that's actually the low shot, and it's often something that we either don't think about or make assumptions as to why it is that way.
Mm-hmm. Yeah, thank you, Adam. Adam is a transportation guru in my mind, so he knows a lot of the details behind some of these numbers. And so this is from the survey respondents. Now this is concentrating, just like this chart is, it's concentrating on that 47% who have to use another method of transportation at least 10% of the time. So the income, as you can see here, of these individuals is the biggest, most obvious thing is that a lot of them are making less than $20,000 a year. So this, that makes sense, right? Because having a vehicle is expensive. Even though gas prices are great right now, in general, buying a vehicle, insuring it, all of that stuff is expensive. And so we did have a number of people say they preferred not to answer, but when you look at this chart, clearly, it was $50,000 and less, with a huge amount of the people in the less than $20,000 bracket. And if transportation is an issue and people are having a hard time even getting to jobs, we'll get into this in a minute, but there's a number of things that ends up happening, which kind of just continues the cycle of poverty that they're in. So this is just a quick note about poverty and low income in Waupaca. So the in the 2017 estimates, and there may be new numbers out now, but it's this was what I had from last December from our applied population lab. So the poverty rate, all ages in Waupaca County, is 11%. And the poverty rate of children is 17.3%. But then when you look at low income, so these are people who are below 185% of poverty level, which sounds really high, right? But it's a really low number. People who would be considered low income make up 25.4% of our population in the county. But then when you look at the children's poverty level, I'm sorry, the children's low income level, that increases to 34.6%. So this is sort of a leading edge indicator, these poverty numbers and these low income numbers, but really an even better indicator of a need and a better indicator of how much low income we have in our county are the free and reduced lunch rates. In 2018, they were 43.2%, which is really quite high. And Christy, I'm not trying to put you on the spot, but if you know of any newer numbers, feel free to add it. Otherwise,
I don't have anything in front of me, but I do know that with COVID, that since then we have seen an increase in families who are participating in food share, and schools are all giving free lunches right now, so that's kind of hard to grab that number. But
yes.
there we have seen an increase.
Thank you. And so how this ties into the chart here is where it says low income, 34.6%, it's actually probably closer to this 43.2% or higher, after COVID. So that's a lot. Okay, so when you talk about poverty and transportation options, so when folks are in poverty and transportation options are limited, and a lot of this is true for, even if somebody is not in poverty or not low income, if they have limited transportation options, these are the things that happen. There are missed appointments, lost jobs. In fact, a local employer in New London let us know that they have a turnover rate of about 40%. Transportation, they know, is a big issue. And in fact, in that first probationary period especially, they can have as much as 39% of their turnover in that first 90 days can be attributed to not being able to get to work. So that is something that they are looking to address heavily. And in fact, part of the program that Holly and Adam and me and Tracy have been trying to put together is actually meant specifically to address employment issues like this, so that people can get to work, so that they can kind of attain some regular employment. So it limits access to jobs, right? So then once you've lost your job and you need to find a new one, it's very difficult to do that. And then you might get a job and then have a difficulty finding a ride to work one day, and then you lose your job. So it just kind of continues that cycle. An inability to meet basic needs like food and prescriptions, and increased social isolation, which is, all of this is the reason why transportation is considered a social determinant of health. So if there's a lack of access to transportation, to affordable transportation, I should add, if there's a lack of access to affordable transportation, it has negative impacts on health because of missed appointments, like medical appointments, because not just missed appointments, it's not like people just don't make the appointment because they can't get there. And not getting your prescriptions, losing your job, increasing depression, increased social isolation, which also increases depression. And so there's a lot of reasons why addressing transportation issues is really important. And so when it's not affordable, it also means increased costs to do all of these things. So somebody already is low income or in poverty, and they need a ride somewhere. When there isn't affordable transportation, it just increases their out-of-pocket costs to try to get to where they're going, and it ends up, just keeping them low income, in poverty, and unable to meet their needs. Adam, did you have anything you wanted to add, or?
Well, I just have a few numbers, just because when you mentioned them in the last slide, I did a quick search online. So 150% of poverty in Wisconsin is $39,000. And
four?
the average, oh, sorry, what's that?
Was that for a family of four or just?
Family of four, I'm sorry, yes, for a family of four, $39,300. But then the cost of car ownership is somewhere between $6,000 and $8,000 a year. So yeah, so those are some of the things that if we start to look at in a normal situation, a normal economy, normal year, those are sort of the impacts on that. And then we can add the cost of housing and all that sort of thing in there too. And you see that number vanish quickly. And so I wanted to throw some of the numbers on that. Then if we start to, as you were saying before, look at the trends of how employment is going in Waupaca County with COVID and all of the situations now sort of taking that downward turn and seeing this was the transportation concern we had before all of this hit. And these are the trends we were seeing before, among the most vulnerable in our communities. And so this is sort of this is where we were last year and now add on to that. So
that's such a great point. Thank you, Adam. And that local employer I'm talking about, I don't think it's a secret. We at our last meeting, they were telling us how they're hurting with all the employees that need to be out because they were exposed to somebody with COVID. So now they're quarantining. Like with all of that, they are hurting for people being able to be there. And so having something like transportation also be an issue is really, really difficult. It's compounding the entire problem. Okay, so then from the survey, going back to the survey and those 77 individuals, the lack of reliable transportation has caused them to arrive late for work, arrive late for medical appointments, skip medical appointments, skip medical treatment, arrive late for other important, arrive late for other things, skip other important appointments, miss work, lose a job, and then this is from the whole survey, not the 77 individuals. This is from the 163 because you can see the none of the above. I have reliable transportation was about 47%. So, and then other. So it is having an effect on the people who need transportation the most. Not having access to it is having significant effects on them. So I'll get into our response now, what our response has been. Luckily, in a neighboring county, there is a nonprofit, I already mentioned, it's called Make the Ride Happen, who has the experience building transportation programs like the ones that we need here in the county. And Waupaca County is part of the area that they can assist. And it's part of the area they can assist, and they have a desire to expand their operations here to help fill these transportation gaps. And I think that that's a really important combination. There's somebody who knows how to do this, who has had lots of success doing this in neighboring counties, in rural areas. And this is an area that they are prepared to and willing to assist. So I started working, at the time we had Nick from East Central Wisconsin Regional Planning Commission before Adam joined us. And Nick had contacted me because he and I had worked together in the past on some other things and said, hey, can you come and talk us through some sort of process? We need to figure out how we can start expanding operations in Waupaca County in a way that builds relationship, doesn't duplicate what's already being done, and basically uses the best of all the assets available and just fills in the gaps that are missing. So we went through what I'm calling a strategic planning light process, because we're kind of still in the middle of that process. A lot has changed since we began it. This is 1 week after the it was like what, March 16th or 17th was when we were all asked to go, or March 11th, something like that. We were all asked to go virtual. And I had this meeting planned, and I just decided to make this meeting virtual. So we did a strategic planning process virtually 1 week after we had to plan for it to be this way. So this planning process really ended up identifying initial priorities, and I'm calling them initial priorities because this group is such a collaborative group. They know that they're from outside the county, for instance, and they know that they have something to offer, and they know that there's already programs in the county that have something to offer. And their main goal was, in this initial push, was to build partnerships up so that eventually maybe they could build these partnerships up so that when they actually want to do a regular, longer, bigger strategic planning process, that process is being done collaboratively with other people in the county that already offer services. And so that's why I'm calling it strategic planning light, because we focused just on building partnerships and building their organizational capacity so that they can start offering services here. So by building organizational capacity, I meant that they needed to apply for grants and hire some people because they already are at full capacity and full staff with the other counties that they serve. And so they're going to need to be able to build up their staff so that they can also serve Waupaca County. So the building partnerships piece I'll focus on the most, though. We ended up doing a little bit of a strategic planning, and when we realized that building partnerships was going to be the main priority first, we did a stakeholder analysis. So we just really ended up basically brainstorming who all the stakeholders were for this particular type of service, and figuring out sort of the, I guess, priority. All of the stakeholders are important, but you need to start somewhere. So we figured out the priority that we were going to start in. We created a communications plan and some strategies for each stakeholder group. And we began making contact with them. Adam's been a big part of that process. And Holly, of course, has been central in that process. And then we also began asset mapping, which I'll show you in the next slide. Basically, I'll tell you about that in just a second. So we began asset mapping, and one of the goals for this year and the early part of next would be to finish that asset mapping process. They've already applied for a bunch of grants, and I'll share a little more about that later. And they've received some as well. So they're really working hard to try to offer whatever they can in order to meet the need that we have. Excuse me. The key messages that they have kind of goes back to that. If you remember nothing else, this is what you should remember from today, which is they really are looking to serve people that are not already served by other programs. They want to coordinate with other programs to ensure the best service possible and to minimize or not have any duplication. And the key message to people who might use the service is that they connect people of any age or mobility to transportation options according to their needs, enabling an improved quality of life and sustained income. And so the plan there is that if they get a call from somebody who already fits another service, which is, here, I'll go right into the asset mapping here. If they get a call from somebody who actually fits into another service, they're going to refer that person to that service. That's their goal. If they get a call from somebody who doesn't fit into any of the services and they can serve them, they're going to serve them. So asset mapping, this is kind of a wonky, silly way of looking at the map. It is essentially, and I have to give tons of credit to Amy Ebert, because Amy's been actually building this based on the database that I gave her. So Amy, thank you very much. She and I have been kind of going back and forth with comments and questions about it, but here's just a snapshot of the very beginning of this asset map. And this is going to help them make referrals and avoid duplication of effort. It's going to also give us all a fuller picture of the transportation system in Waupaca County so that assets can be connected and leveraged. So we want to not only use something like this to help us avoid duplication of effort, but we also want to understand the whole system better so that maybe we can make some other connections later on. And so right now we're just gathering the information. Adam, I didn't even ask, did you have anything you wanted to add to any of these things that I just shared with you? Because you've been involved in this part and I didn't even ask you.
Well, not a problem. I was gonna let you go through and explain some of that groundwork, because the other thing that I just want to introduce people to, and what Jessica just described here, is what in the industry is known as mobility as a service, or MAS, MAAS. And so the idea is to provide transportation in a way that is essentially the background work is invisible to the end user. And so the more that we can centralize how someone gets the ride they need, independent of where they're going or what they qualify for, the more effective the whole system can be. And that's one of the reasons asset mapping becomes so helpful, and programs like the Make the Ride Happen can be so successful, because they eliminate a lot of the redundancy of call centers and trip planners and a lot of those other pieces of the system that take up a lot of time, and each individual agency or department could be doing independently, but that gets expensive. And so if we're able to centralize that mobility as a service and say, have one phone number or one dispatch, that way we're able to take all of these partnerships and make it a much more efficient process that not only works better for the end user, but also ends up being much more cost effective and much more efficient to get grants for, and show that we are a collaborative effort. So it all sort of works together under that mobility as a service umbrella.
Thank you. All right. Oops. Okay, so this is it's unfortunately Holly, and Holly was unable to join us this morning because I don't recall the full number of grants received, but they have been making a lot of progress there. So I do know that they received a grant through the Clintonville Foundation, or Clintonville through the New London Foundation, that that was $20,000 a year over 3 years, so $60,000. They are going to be submitting to Theta Care here any day, and Theta Care has shown an interest in this project. And I do know that they've received some other grants. I've been meaning to record that information from Holly, and just haven't gotten there yet. And so my point, though, for bringing that up, is that this idea is recognized by grantors and by people who want to fund. They know that transportation is an issue, and they're willing to fund quite significant, giving quite significant amounts to help fund programs like this. So support from the community. There's even a specific, in New London, there is a transportation meeting. In fact, Adam and I have that right after this meeting. I sometimes show up a little late to the one in New London because this meeting varies in length. So sometimes I end up a little bit late. But there's a dedicated meeting of people in in New London who care a lot about the transportation situation there. So the efforts that we're working on right now, we are going to start with New London, but the intent is to, as soon as we're able, to expand that reach out and to cover, other areas of the county. But we have to start somewhere, right? And they've been building, Holly and Adam have been working on building partnerships with some key stakeholders. Key stakeholders would be like our DHHS office, the county's transportation committee itself. Holly's been attending those meetings, and I've started to attend them, starting with this last meeting as well. I wasn't able to do that in the past because it happens to be the same day as Leadership Waupaca County. So once that starts back up, I may not be able to attend again. So yes, building the partnerships, and also building partnerships with employers in the New London area. So that a lot of that has been going on. But our next steps are going to be to complete the asset mapping, to identify barriers that we're having. So identify barriers that we're having to building some type. Sorry, my cat is biting me off to the side here, so I'm like trying to manage talking and a cat biting me at the same time. So we're going to be, yes, identifying barriers that, continuing to identify barriers that people in our county are having with transportation, and then identifying barriers that that we might be having to launching a program like this and trying to address those. And of course, continuing to build relationships with stakeholders, including employers. Expanding the call center to Waupaca County will be a good next step. And then keep learning about the needs of residents and employers, and don't just take what is happening today as what the need is, because that need is evolving like crazy.
And one of those key barriers that we often find, or that we anticipate finding even more, is the sharing the word about the services availability and who can take advantage of it. And so that's something that we're really looking for partners once we have a brand and a number and a something that we can share, because a lot of the people we want to serve, again, particularly in the rural communities, don't necessarily have access to a computer or email regularly. And so, and again, specifically with the pandemic and some of those public places that would normally provide that kind of internet access, or even just social access, people aren't able to take advantage of right now. And so we're thinking of trying to come up with new ways that we can spread the word about this service, and how do we find the people who need it, because some of the barriers that are preventing them from finding transportation are also going to be in the way and preventing them from finding out about this solution to the transportation barrier. And so we're coming up with unique ways that we can spread the word, whether it is through the doctor's offices and the clinics and the hospital, or it's through various employers, or it could even be through some of the vehicle providers. So whether that's a car rental company who, oftentimes, or right now, they're not renting a bunch of cars, but often they will set up a program where they will contribute a vehicle to be the van share ride, that actual vehicle for it, or car dealerships that are not selling a lot of cars right now, but can get into a lease program with the transportation service and provide that vehicle. And so they can share it out among their constituencies as well. So those are some of the things that we're thinking about for this next step of the next phase of the project.
Yeah, and another barrier that for our own, I guess, with trying to expand to Waupaca County, from I think one of the barriers can be a perception of competition, that we're trying to compete with services that are already in existence, which is just really not at all what this is trying to do. And yet, that perception will still exist even after we have shown and proved that this is not what we're trying to do. So that's definitely a barrier that we're facing, or that we will be facing soon. So before I do a really quick summary of my other 2020 programming, do you have any questions about this?
Jessica, I just had a question about how you were just talking about who to reach out to at this point, or what's next. I was on a call about something similar, and they mentioned to me that we should be tapping into the public health nurses or behavioral health nurses, because they can be just such a wealth of information right now about the population that we're serving. And mine was not about transportation, but maybe that's a good avenue as well to reach into or tap into, as public health nurses, or at least making sure that they're aware of the services and, could be a connector.
Thank you.
Yes, that's a great point. What we're finding in some of the other communities is those public health folks, nurses, and staff all over are doing a lot of the food distribution coordination, and so they are, very often have a good database already of who could use this sort of service. It's a good point.
Yeah, and I've also just in conversations heard that a lot of individuals who would usually be receiving services in their home are now needing to travel because whoever, whether it's a nurse or a case manager who would usually travel to their home, they're no longer entering the homes. There's more of a neutral location that now the customer or the patient would need to go travel to, but obviously transportation is an issue. So maybe things you already are very aware of.
Thank you. Any other questions?
I've got one for, maybe Adam could answer this one better. The people that get on this program, how long are they normally into a rideshare program? I mean, if they're low income, is this something for like young families that have small children, have a great deal of expense? Is this something that affects them more so that after a few years they get off this program more so than maybe someone that's elderly and handicapped and just doesn't have that opportunity to get themselves out of a situation where they could afford a car?
So I think your theory is spot on. We don't necessarily have a lot of data because the ones that have existed in this area have only existed for 3 years. I think is the longest running one right now. So while I think you're exactly right, I think that's going to be likely a trend we find. I don't know that we've been able to gather that data yet. I think it is with anything that does help to initial employment, you do find that people, because they have a higher rate of sticking where they are supported, that is something that makes it easier for people to move up. And whether they then go on to buy their own vehicle or figure out some other carpool strategy, that's going to be an interesting thing to find, definitely.
Okay, thank you.
Yeah, there are also other programs that that Holly at Make the Right Happen has been talking to as sort of it's still new in development, but there are other programs that help people get a car. There are programs that help people. So once they get to a certain point, they might be able to get a car, but maybe are still missing, maybe there are other, financial needs that they have that they just need to fill the gap between where they're at financially and where they need to be to get a car. And there are programs that help with that. And there are also programs that help fix cars. And so we're not just looking at offering a service like this, we're looking at coordinating with other services to hopefully kind of create that longer term vision like you're talking about, which is getting people access to reliable transportation on their own, but starting with the basic need the way it is right now. So I know Holly's been talking to a lot of people who run to some people who run programs like what I was just describing, and we're looking into that as well.
And then I just looked, so oh, go ahead. What was that?
You're good.
Oh, okay. One of the other things that I was just looking at is, so again, in the Winnebago County version of this, one of the things that they did find that first year that they were offering the service is that because people were able to stick with the company that they were working for and get promoted, they then went and found new places actually to live that are more conveniently located to be able to get there. So it was actually not a transportation solution. In some of the cases, it was they could afford a new apartment or even a house because of their ability to continue to move up, particularly in manufacturing settings. So that was an interesting thing that did come about from that first year.
Yeah, they were able to make it beyond that 90-day period without dropping off. Yeah. Any other questions? All right. Thank you so much, Adam, for joining us, and you're welcome to stay, of course. I'll move on really quick, and this will be fast. So other 2020 programming that I've engaged in, these are sort of the highlights of the things I've been working on. So with organizational development, earlier this year, I worked with the Clintonville Foundation on a process. It was had a twofold purpose. First of all, they were looking at trying to integrate their board. A whole bunch of board members were moving off, and a whole bunch of more board members were coming into the board. And so we got together the board members that were leaving, the new board members who hadn't started yet, and then of course the board members that were staying. And we kind of did this process that honored the institutional knowledge of all of the board members that were leaving, because some of them have been on it for a long time. It honored the brand new ideas that the new people were bringing in, and they kind of created this process that ended up in a few priorities, and it worked really well, and it helped build relationships among the board. And they were talking about working with me again in the fall, but with COVID and everything, it just kind of got stalled for now. So they want to keep going with their original plan. So we'll hopefully be talking with them again soon. I worked with a couple of other folks across the state on something we're calling this relational networking program. What this is meant to do is help nonprofit leaders take on a collaborative leadership role in the community. And the whole purpose of this was to get nonprofit leaders to understand how to best collaborate with other nonprofits in order to have bigger impacts in the communities. That pilot ran actually last month in October. And so we're recalibrating, and we're going to be running the program again soon. Leadership, one of the interesting things, by the way, about that relational networking program is that I've never had a program where people say, we think you should have longer sessions and more sessions. And that is what they said about that program. We had 6 sessions, and we had 6 1.5-hour sessions, and they wanted this more sessions and longer sessions. So I don't know, that sounds like a really big program to me, but we're recalibrating, and we're seeing if we can meet some of what they're saying without making it too onerous of a program. Leadership development. So Leadership Waupaca County is taking the year off as it usually exists. Instead, we're engaging in a planning process with the steering committee, where we already have changed our mission statement, and we're looking forward to seeing where we can grow. The Local Government Leadership Academy was something I helped to plan earlier in the year. That program is a partnership with the Counties Association, and it has been going really well. It's really it's a great program where department heads, county board members, town board members, city council members, they can all come together and talk about the issues that they're all having, and many of them are very similar issues. Last year we had a sheriff in there. We had department heads from like IT and accounting and things like that. And then we also had folks across the municipal gamut. It was county. We had I think one state person in there, and some folks from local municipalities, and that has been going really, really well. And then I'm working on a Spanish language leadership program. Actually, a few years ago, I was approached by someone in our county asking if we could do some of the Leadership Waupaca County stuff in Spanish. And I tried to find a way to do that at the time, and it was just not feasible. And now we have the ability to do it. And so I've been working with a colleague in Greene County and several co-creators. What we're trying to do is support a program like this and co-create with people who actually will be able to help bring some cultural relevance to what we're trying to teach. So we have gathered a group of about 10 co-creators. They're all Hispanic or Latino co-creators. And we are very excited about the direction this is taking. It has gotten the interest of our organization's leadership. They didn't have a lot of funding for us, but they're giving us a little bit of funding to help us pull this through. And we'll be launching it locally and statewide, meaning that we'll be widely promoting it locally, but then we'll also be promoting it with our colleagues in other counties for them to pass on to the networks that they know that are the Spanish language speakers. So, and then I'm part of a group of people that are working on a curriculum for nonprofit management. So this is not related to the relational networking program. However, we think that the relational networking program could become a prerequisite for taking the nonprofit management program. We're looking at this offering some certificates for nonprofit managers. What we're really hoping to see is that these folks leave with a sense of more confidence and in their abilities to have the outcomes in the communities that they're hoping to have. And then economic development, I've been working with the governor's task force on broadband, and I'm the facilitator for that group. That the recommendations that come from that group will help decide how money on broadband gets spent. And we know that broadband in Waupaca County is an issue, and we want there to be some good outcomes for for rural areas like us. And then I recently was offering through our Center for Community and Economic Development, the Facebook for Retailers program. I was supposed to be part of the Train the Trainers. They haven't gathered enough of us yet in order to offer that. So I'm on the list. I should be getting trained hopefully soon. But basically, I would help support some retailers who have had to move a lot of stuff online. I would help support them in understanding how to get the most out of being able to do this kind of e-commerce that and hopefully keeping them from having to shut their doors. So any questions about all of that? This is all the stuff, the highlights of the stuff I've been working on. Oh, the last thing is I was part of a team of people who got a national award for a series that we did on resilience. It involved individual resilience, family resilience, and then the part that I was involved in was community resilience. So now I'll stop. Any questions?
Congratulations on your reward.
Thank you. Doesn't come with any money though. All right. Well, thank you very much. It was kind of fun to share this with you all.
Okay, well, thank you very much, Jessica. I think we're moving on to Chris's program.
All right, good morning. A couple of updates before we take a little bit of a winter hiatus, at least as far as meeting wise. Going in order, facility and staff updates, working with in a couple of things. State staff are continuing to primarily telecommute. We have a calendaring system so that when they come into the office and other approvals, just to make sure that everybody stays safe. What we're trying to avoid is a inadvertent high density of staff in the office, which could increase transmission. Nothing necessarily official, but we've pretty much been told the plan for the first quarter of 2021 for there to be primary telecommuting from the state staff, largely in place because we're anticipating over the holidays another surge, which will affect our programmatic work and overall health and safety. And probably need some time for the vaccine to roll out and for it to start to take effect within the population to increase safety. Working within our county temporary guidelines, we always have one of the staff members, the office, who is, unless there's unforeseeable circumstances, the office is always open. There's always at least one person in the office to answer phones or to handle walk-ins. Will, depending on the workload and the ability to telecommute, oftentimes we are utilizing with the temporary telework policy to be able to reduce our density. Sometimes having one of either Annette or Amy work outside of the office that allows for another of the state staff to come in and work without creating that density. So there is a method to our madness. We have a shared calendar system that everyone, including myself, so I even had to remember to put myself on the calendar to let everyone know that I was going to be in the office and taking up space as we go to communicate. So working through that, not seeing a lot of change, moving forward relating to that as far as some of our health and safety. That said, in the grand scheme of things, as you listen to Jessica and you read the reports, it's not like we're sitting around eating ice cream and watching soap operas. Our staff are doing a lot of really high impact work. We're making it work. It may not be exactly what it was, but it's in some cases, in many cases, they're creating something new, which in some things are going to carry on. They will carry on the new methods and the new ways. Not all of them, but and not totally replacing everything that we would have done. So that's good news. Our county budget overview, we're going to see overall our department is going to be under budget. There's a lot of things relating to our programming that took a lot of changes as far as mileage. Our staff, we are outreach educators, so usually that means traveling. Haven't done that. Postage, not as many mailings. One of the things that we were hoping at the end of 2019, the whole county went to a managed print system, and so we whole managed contract. we were gonna need, it was the fourth quarter of 2019, we were gonna use the first half of 2020 to get what our numbers so that we could make any good guesses or guesstimates for our 2021 budget. That would have been proposed, and obviously that would shot the heck. So we'll still see what that will look like. So in the 2021 budget, we included status quo. We'll just have to see how things look as far as our new photocopying will look. So still looking at, have a couple of weeks left just to make sure that there are any items, small items of equipment or small pieces that the staff would need to continue on their outreach education from remote. You know, if there's, I know we worked with to get like document cameras to be able so that individuals, instead of having the web cameras, so like if you're demonstrating something, like you know, knitting and crocheting or some other things. I'm thinking of some 4-H projects that might need some fine detail, and that there's some you know, some technology tools that are designed to do that. So they're not too expensive. They're under $200, working to make sure that staff who need them have those tools and those types of things. So moving on, area, state, and area, region, and state updates. Couple of things relating to the state budget. So with our staff, with a good chunk of our staff is UW employees supported by our contracted services agreement. Our state budget, we did have for the 2021 budget, we have our final numbers, or at least the numbers that are into the state as far as what our portion, Division of Extensions portion of the budget lapse is. Basically, the good news is that we're going to be able to utilize reserves, use open positions, and we will not have to do any layoffs or any other permanent staff reductions in order to meet that lapse. Our reduction, this is again, our reductions in travel and those types of things are beneficial or helpful in that standpoint, because they'll be utilized to offset the budget lapse. The 2021, 22, 23 budget, the next biennial budget is after the first of the year. We'll begin the process of building all of the cabinet level positions. So the University of Wisconsin system, the DNR, Department of Transportation, all of those state agencies they've either submitted or are submitting their budget request to the governor. So then the governor will prepare his proposed budget. The university, so interim president of the UW system is Tommy Thompson. So he has prepared a budget that actually includes, he is proposing in the UW system budget an increase for extension positions for regional educators. We're hopeful, we haven't gotten word, or at least we've got general rumblings that will be included in the governor's proposed budget. So that's the next piece. However, we're not anticipating, based on the last couple of budget processes, we're not anticipating that the legislature is going to take on any increases in education based on their current track record. So while we'd like to be hopeful and optimistic, we'll also be realistic. One other thing, and that's the other bullet item, is that UW staff between January 1 and June 30th to also help offset the current year budget lapse will also be embark on furlough 2.0. So our second batch of furloughs, in which there would be a mandatory work and pay reductions for all UW staff. So we will be working to administer and implement that. For the portions, the county in the county contract that will be for those reduced work, for those reduced work periods, there will be a proration of the county contract. It's not going to turn out to be a lot of money, but there will be a rebate back to the county because it's not the county's fiscal decision to have the staff not work. It's the state, so there will be a rebate back. But because, and that's the way that we have to do it, because it's a Federal Bureau of Labor Standards issue. Furlough is very well documented by a lot of case law and process and standard. So it's not like, well, the staff can work a little bit because they're actually working. Their employer is the University of Wisconsin, and so they have to work in a non-working mode for that time. The other interesting thing, and that this does go in, and this is just kind of one of those things that it's the way that it fits, and it's just kind of crazy. In 2019, when they did the 19 to 21 fiscal or biennial state budget, the legislators wrote in a state staff plan. So all state employees were going to get a wage increase. It was going to be 1%, 2 plus 2, 2% on January 1 of 2020, 2% on January 21 or January 1st of 2021. The only thing is, in the grand scheme of things, is that they wrote that in as as language only. They provided no dollar amounts to any of the state agencies to fund any of those to fund those increases. So it was an unfunded mandate that went through all of the approval processes. So in the grand scheme of things, the state staff are going to receive an increase that will go onto their base salaries, but then they will have but the furlough is going to roughly offset that unfunded increase that there are no dollars to pay for that. So it's a little bit of it's really dumb in my opinion, but it's things that happen way above my level. And at the time, our state tax collections and everything were all going along really, really well. In the grand scheme of things, state employees have not had pay plans in, I think it was either 6 or 8 years. There had not been a pay plan increase. So it was really, it was a catch up to be able to do that. And then our current situation hit and things got turned on its side a little bit. Some things had to go forward and other things, there have to be adjustments to make that. So with the state budget updates, it does create some stress on filling vacant positions, of which we have one in our office. I think the meeting is next week. I'm part of a work group, a part of an area director work group engaging with the Ag Institute director and a small other group of ag program directors to work on the agriculture staffing plan on how local agriculture outreach education will be available to all of the counties and how that's going to look. There was an optimistic hope that if we were to wait and weather through COVID, that we would be able to not necessarily return back to something that looked a little bit similar to what the previous was. With our current with the current state budget as it is, with the lapses and the projections, or at least the rumbling on the street, is that essentially we've told the plan for more reductions is not going to allow status quo moving forward. So I'm part of a work group along with a number of other work groups to work on what does the ag staffing plan look like in the state of Wisconsin to ensure that the agricultural community has connections to extension, division of extension both outreach educators and or connections to our state specialists in specific areas. So it's going to be a little bit slow. We have a temporary transitional plan in which Amy and I work together to, if we have inquiries, to get individuals connected with extension ag outreach educators in neighboring areas or other, even outside of the area, if that's what their area of focus is. So so things are moving forward, albeit slow. So just giving you the update that we're working towards that, and I do not have any deadline, any dates or deadlines or anything like that as far as the work group is. Our work groups are just getting going. Essentially, it's looking at we could move a lot faster if we laid everybody off and started from scratch. And that is something that our administrative leadership, going all the way back, has said that is not a strategy that they're going to employ. So then we will have to work through the other methods of position vacancies, whether through retirements or individuals leaving their positions, or however that might be, or other changes to work through those situations. So I gave a whole bunch of stuff. I'm happy to answer any questions or listen to any comments relating to that or anything else that anybody has for me.
I was just curious. I know Waupaca County used to have a transportation program where the people would pick up people. I think they still might do it on a voluntary basis, but they would get paid whatever. Why did that program just run extinct for what?
Jessica, do you have any from like some of the background research that you might have dug into? Not expecting you to know the answer, but you would be tossing it to.
Can you actually repeat the question? I was having a little trouble hearing.
Okay, Waupaca County used to have a program for that paid people to pick up other people in the county that needed to go to doctor's appointments or whatever. And then all of a sudden that program just went away. Why was that, or what?
Yeah, I actually don't know why that went away. I do know that there still is a volunteer-based program. That's actually something that I was planning on meeting with Melissa from our DHHS office. She recently just took over that the transportation duties. She's with the Aging Disability ADRC. I can't recall what the R is. My apologies. But she's with the ADRC and she recently took on the transportation. And I was actually planning on meeting with her recently to kind of learn a little more about things like what you just asked, and to help us build some relationship with the DHHS office as well. And Adam, it looks like you have something you might be able to add. Thank you, Penny. It's resource, Aging Disability Resource
Center. Yeah,
Center.
Aging and Disability Resource Center is the ARC.
Yeah.
Yes, and they're fantastic. I believe I'm remembering correctly, the program that was in Waupaca County was through Easter Seals. And one of the things that happens when it's a nonprofit led program or a nonprofit wholly run program is that if someone leaves the organization, or if a key volunteer retires, those sorts of things that happen, can no longer, somebody can no longer be a part of it, then these things do sort of vanish. And so that's one of the really important reasons that we've been trying to connect resources so that nothing is dependent on just one person, and we can make it sort of institutionalized that this is a service that can be provided. It makes it easier for grants as well, because if it is fully dependent on one organization to fund it, that's also challenging. So as soon as any budgets get cut or resources get moved to some other agenda item, then the transportation can also suffer that way. So the more that we take it away from just being one volunteer organization, or I think it was Easter Seals, and there was also a local church involved in the old program. And and so I believe what happened, because that was all before my time, of course, but I think one of the things that we've seen it not only in Waupaca but also other areas is this idea that if the community comes to rely on a nonprofit or a local person, then it's not a very stable or sustainable program.
So, in my apologies, I thought you were asking about a program that the county, like DHS office, had run. So thank you, Adam, for filling that in. And the difference between this, the nonprofit that Make the Ride Happen, it makes up, is that they have been, this is what they do. It's not like a subset of their mission. This is their mission, is to do transportation. So that there's a difference between, I think, an organization where it's a subset of their mission and an organization where that is their mission. Just to add to that.
Thank you. Any other questions or comments?
I think we're down to stating that we don't have a December meeting, and our next meeting is January 25th, 2021. Anything else to say? We're done. Thank you very much. Have a good holiday, everybody. Merry Christmas. Have fun.
Bye, thank you.
Thank you. Bye.